Before we begin, I want you to do something very important. Take a close look at your skin. Not tomorrow. Not next week. Right now. Because one of the earliest warning signs that your kidneys may be in trouble could already be visible on your body, and millions of people are missing it every single day. Most people believe kidney disease begins with changes in urination, back pain, or extreme fatigue. But what if I told you that your skin often reveals the problem long before those symptoms appear? As a physician who has spent decades caring for older adults, I have seen countless patients ignore these warning signs, assuming they were simply getting older. Unfortunately, some discovered the truth only after significant kidney damage had already occurred. One patient in particular came to my office desperate for answers. She had been suffering from severe itching for months. She changed soaps, detergents, lotions, and even her diet. Nothing helped. She thought it was allergies. She thought it was dry skin. What she didn't know was that her skin was desperately trying to warn her that her kidneys were failing. Today, I'm going to reveal 9 silent kidney disease symptoms that can hide in your skin. Some of these signs are surprisingly common. Others are rare but extremely dangerous. And I strongly encourage you to stay until number 7 because it is one of the most disturbing warning signs doctors can see. Before we begin, please subscribe to the channel, like this video, and tell me in the comments where you're watching from. Every comment helps this information reach more people who may need it. Now let's get started. Number 1, persistent itching that never seems to go away. Have you ever experienced an itch that simply refuses to stop? Not the occasional itch that comes and goes, but an itch that follows you throughout the day and keeps you awake at night. This is one of the most common skin complaints among people with kidney disease. When the kidneys are no longer able to effectively remove waste products from the bloodstream, toxins begin accumulating throughout the body. These toxins can irritate the skin and trigger intense itching. In some cases, phosphorus levels rise as kidney function declines, making the itching even worse. Many people scratch so aggressively that they create cuts, sores, and infections. If you have unexplained itching that persists for weeks or months despite using moisturizers and changing skincare products, do not ignore it. Your skin may be telling you something important. And remember, the warning signs become even more alarming as we continue, especially number 7. Number 2, extremely dry, rough, or scaly skin. As we age, some dryness is normal. But there is a significant difference between ordinary aging and skin that suddenly becomes excessively dry, rough, flaky, or cracked. Healthy kidneys help maintain the body's delicate balance of minerals and fluids. When kidney function declines, changes can occur in sweat glands and oil glands, reducing the skin's natural ability to stay hydrated. The result can be skin that feels rough like sandpaper, appears flaky, or even resembles fish scales. Many older adults assume this is simply part of getting older and never mention it to their doctor. That can be a mistake. When severe dryness develops alongside other symptoms, it deserves medical attention. Your body may be sending a warning signal that should not be ignored. Number 3, unusual rashes, bumps, blisters, or sores that heal very slowly. Healthy skin has an incredible ability to repair itself. Small cuts heal. Scratches disappear. Minor wounds recover without much concern. But when the kidneys are struggling, the body's healing processes may also suffer. Some people develop unusual rashes or dome-shaped bumps that become irritated and crusted. Others develop fluid-filled blisters or sores that remain open for weeks. Reduced circulation, toxin buildup, and immune system changes can all contribute to poor healing. If you notice wounds that linger far longer than expected, this is not something to dismiss. Many serious medical conditions can interfere with healing, and kidney disease is one of them. The earlier you investigate the cause, the better your chances of preventing more serious complications. Number 4, changes in skin color that seem to appear without explanation. This sign often develops so gradually that people fail to notice it. Family members may notice it first. Kidney disease can sometimes cause the skin to develop a yellowish tint, a gray or ashen appearance, or areas of darker pigmentation. These changes occur because waste products and metabolic imbalances begin affecting the skin's appearance. Some people describe looking tired all the time. Others notice they no longer have the healthy glow they once had. If someone close to you has commented that you look pale, gray, yellow, or different than usual, pay attention. Sometimes the body sends warnings long before pain or obvious symptoms appear. Number 5, swelling around the eyes, hands, feet, ankles, or legs. This is one of the most important warning signs of declining kidney function. Healthy kidneys remove excess fluid from the body. When they begin to fail, that fluid has to go somewhere. Often it accumulates in the tissues beneath the skin. You may wake up with puffy eyes. Your rings may suddenly feel tight. Your shoes may become uncomfortable by the end of the day. Your ankles may leave deep sock marks. Many people blame these changes on age, weight gain, or standing too long. While those factors can contribute, persistent swelling should never be ignored. In some cases, damaged kidneys leak protein into the urine, causing even more fluid retention throughout the body. If you've noticed unusual swelling recently, make sure you discuss it with your healthcare provider. And don't go anywhere because the next signs become increasingly rare, increasingly serious, and number 7 may be one of the most shocking medical conditions you've ever heard of. Now we're entering the part of this video that most people have never heard about. The next warning signs are less common, but they can be far more serious. If you've watched this far, you're already ahead of most people because awareness is often the first step toward protecting your health. Let's continue with number 6. Tight, thick, shiny skin that seems to appear without explanation. Have you ever noticed areas of skin that feel unusually tight or stiff, almost as if the skin is shrinking around the body? Some people describe it as feeling trapped inside their own skin. In rare cases, individuals with advanced kidney disease can develop a condition that causes the skin to become thick, hard, shiny, and difficult to move. The surface may look stretched, polished, or even resemble the texture of an orange peel. Simple movements such as bending the fingers, walking, or standing up may become uncomfortable. Although this condition is uncommon, it serves as a powerful reminder that kidney disease affects much more than the kidneys themselves. It can impact the skin, muscles, blood vessels, and overall quality of life. Which brings us to number 7, the warning sign that even many healthcare professionals rarely encounter. And once you understand what it is, you'll never forget it. Number 7, a white powder or crystal-like substance appearing on the skin. Imagine stepping out of a shower or finishing a walk on a warm day. You begin to sweat. Nothing unusual so far. But as the sweat dries, a strange white powder begins appearing on your skin. It almost looks like frost. Tiny white crystals covering parts of the body. It sounds unbelievable, but this condition is real. Doctors call it uremic frost. It typically occurs only in very advanced kidney failure when waste products in the blood become dangerously elevated. The body becomes so overwhelmed by toxins that some of those waste products are released through sweat. As the moisture evaporates, white crystal-like deposits remain behind. If someone develops uremic frost, it is considered a medical emergency. This is not a cosmetic issue. It is a sign that the kidneys may no longer be performing one of their most critical jobs. Fortunately, this condition is rare. But if you ever see anything resembling white crystals or frost forming on the skin without explanation, seek medical attention immediately. And now we move to one of the most painful complications associated with kidney disease. Number 8, painful dark skin lesions that can become life-threatening. This condition often begins innocently. A small painful area appears on the skin. It may look red, purple, or slightly discolored. But over time, the pain becomes severe. The skin begins to darken. The area may turn gray, black, or develop open wounds that refuse to heal. Some patients describe the pain as unbearable. What makes this condition especially dangerous is that blood flow to the skin becomes compromised. Without adequate blood supply, tissues begin to die. In severe cases, portions of the affected skin may be permanently damaged. These wounds can also become infected, leading to serious complications that may threaten a person's life. This is why doctors take unusual skin lesions very seriously, especially when they are painful, rapidly changing, or becoming darker over time. If you ever notice a skin lesion that worries you, don't wait weeks or months hoping it will disappear on its own. Early evaluation could make all the difference. And finally, we arrive at number 9, a warning sign that many people overlook every single day because they see it constantly but rarely pay attention to it. Number 9, changes in your fingernails. Your nails may reveal more about your health than you realize. Doctors often examine the nails because they can provide valuable clues about what is happening inside the body. In some individuals with kidney disease, the nails develop a distinctive appearance. The lower portion may appear pale or white while the upper portion becomes darker, pink, brown, or reddish. Others notice unusual horizontal lines running across the nails. Some develop spoon-shaped nails. Others experience nails that become brittle, weak, thin, or prone to breaking. While nail changes alone do not confirm kidney disease, they can serve as important clues when combined with other symptoms we've discussed today. This is why it's worth taking a few moments every now and then to examine your hands, your skin, and your overall health. Sometimes the body whispers before it screams. The real question is whether we're paying attention when those whispers begin. Before we finish, I want to leave you with one important message. The signs we've discussed today do not automatically mean you have kidney disease. Many of these symptoms can occur for other reasons. However, they should never be ignored, especially if several of them appear together. Kidney disease is often called a silent condition because many people feel perfectly fine until significant damage has already occurred. That's why awareness matters. That's why prevention matters. And that's why videos like this can save lives. If you noticed one or more of these warning signs, consider speaking with your healthcare provider. Simple blood and urine tests can provide valuable information about your kidney health and may help detect problems before they become serious. Now I would love to hear from you. Which of these 9 warning signs surprised you the most? Was it the severe itching? The swelling? The changes in skin color? Or the shocking condition we discussed at number 7? Let me know in the comments below. I read as many comments as possible, and your experience may help someone else who is watching today. If you found this video helpful, please subscribe to the channel, give this video a thumbs up, and share it with a friend or family member. You never know who might need this information. Thank you for spending these minutes with me. Take care of your kidneys, take care of your health, and remember, the earlier you recognize the warning signs, the more opportunities you have to protect your future. Stay healthy, stay informed, and I'll see you in the next video.